Obviously, when somebody comes to an emergency department, it's probably not their best day.
Well, they're in a situation that they're unfamiliar with. They're in an environment that most people are unfamiliar with.
How can we help you this morning?
I threw my back out at work.
It's our job to make them as comfortable as possible from the moment they walk through the door to when they see the emergency department physician to also when they leave on discharge.
And did your head hit anything?
I think the first thing is to let everybody know that they're in competent hands, that their illness or injury will be taken care of quickly, and the expectation is that the quality of care is always as good as they can receive anywhere in the country. We are at the Mary Washington Freestanding Emergency Department. A freestanding emergency department is a self-contained emergency department that's separate from a main hospital but has the full capacity to provide emergency services that any other emergency department would have.
My name is Shin Sato. I'm the medical director of the emergency department at Mary Washington Hospital. Hi, how do you do? The concept and the implementation of the freestanding emergency department took many years to develop. It was a collaboration amongst the Mary Washington Hospital administration as well as my group, the Fredericksburg Emergency Medical Alliance. I was here for the opening of the emergency department. It was a great day. There was definitely demonstrated a need for this emergency department in the community.
This part of the county was not very well served geographically for emergency services, so there was, at that time, long waits at the main hospital, Mary Washington, because that capacity had been exceeded. So this served a very useful adjunct to that service that were already offered at Mary Washington.
Some people have a misconception that it's an urgent care center, when in fact it provides all the services that you'd expect to see at any major hospital.
We have a lab on site and we have the full use of the radiology services of the adjacent building that was already here prior to the freestanding emergency department being built.
We can get CAT scans done here, we can get x-rays done here, we could even get MRIs done here.
Can you squeeze my hands?
The staff is all fully trained just as they are at Mary Washington. They are all certified in emergency care, so it's the same basic quality of service you receive at Mary Washington is delivered here.
The staff is very, very pleasant to work with. We're all dedicated to serving this community.
We get a lot of hands-on patient care, and that's what I like. That's why I do what I do, is that you get to see a lot of people. You get to hopefully intervene at a really rough time in their life and make a difference.
Silver pocket watches for this milestone.
Typically, we can get patients in and out pretty quickly, so I think patients recognize that that's a really important component of their emergency care, and that makes them feel at ease.
The residents of the community of the county of Spotsylvania have voiced their opinion in years past and said that they were tired of waiting hours at other facilities. We recognize that with facilities being very busy, backlogged by wait times that might be hours, this facility oftentimes has wait times of less than 30 minutes. Patients arrive here and they say, your wait times are incredible. For Mary Washington Hospital to have built a complex consisting of a 24-hour, 7 days a week freestanding emergency department along with the full complement of radiologic needs says a lot for the community that Mary Washington Hospital committed to helping out the residents of Spotsylvania County and the surrounding areas.
We're going to get you hooked up to the monitor.
Initially, they were predicting a certain patient volume, and we've actually doubled that.
Currently, on average, we see about 55 patients a day. That number fluctuates from day to day. Some days we've seen as high as 90 patients per day.
Interestingly, we're really surprised at how many physicians are referring their patients to this facility versus the other facilities in the area, simply because the physicians recognize that the quality of services here and that in most instances the patients can get seen quicker and if they don't require extensive testing or admission, they can be home faster.
The freestanding emergency department will be around for years to come. I don't see our community needs getting smaller, I only see them getting bigger, and the freestanding emergency department is here to fill that need.
All of us that work here are very happy that we were able to be sort of in the groundbreaking component of making this whole facility happen. And the fact that it's so well received and has exceeded everyone's expectations is sort of a testimony to the hard work of the physicians, the nurses, the administrators who really put this together.
It feels special to help friends, family members, and people that I see on the street every day. It's a special thing to do.